Hey, Annika.
Yeah,
My
Marissa.
grandma just got diagnosed with diabetes. What is that?
Well, lucky for you, we just learned about diabetes in Professor Humber's class.
Whoa.
So I can explain it to you perfectly. All right, so we have a perfect visual right here. Here, give me your phone. So, your cell can be represented in this phone. It needs energy, right? So, basically, your body is gonna make energy from the things it eats, and that's called glucose, which energy comes out of this outlet, right? And so, basically, your body also, in the pancreas, makes insulin, which is going to unlock that energy and transport it into the cells. But someone who has diabetes, their body, it doesn't make any insulin. So therefore, they don't have this. And when you don't have your phone cord, then you can't charge your phone, and therefore you can't get any energy.
But then your phone dies.
Yeah, exactly. So someone with diabetes, they're gonna have a lot of glucose in their bloodstream, and they're not gonna have any energy. So some of the symptoms of diabetes can include someone being very tired because they don't have enough energy, and then their body's also going to use their fats and tissues to get that energy into their body. And then also we can't forget about the excess glucose in the bloodstream, which is gonna make the blood very thick. And so that's gonna cause poor circulation. That's also going to have problems with the eyes because there's not enough blood getting to the eyes. And then there's also going to be tingling in the hands and feet because that's the furthest thing away from your heart, so you can't get enough circulation there. And there's also going to be sexual problems and vaginal infections. And then also someone with diabetes is going to be very thirsty because they're trying to flush out the excess glucose from their system, so they're also going to be peeing a lot.
But I don't want my grandma to die. Is there anything that she can do to fix this?
Yeah, there's some really good treatment options actually. So she can do medication, there's oral meds, and there's also shots of insulin to help use up the glucose. And then there's also going to be physical activity to get rid of the excess glucose. And then there's also maintaining a diet which will keep a steady blood sugar. And there's also keeping track of your blood sugar. And someone with type 2 diabetes can also be at risk if they're overweight because the insulin can sometimes make it hard. If the cells are fatty, then it can make it difficult for the cells to use that energy. And then also there's a genetic component as well as being over the age of 40. And that's everything you need to know. Your grandma's gonna be just fine.
Good.
Hey Marissa.
Hey Annika, I just found out my grandma's having heart problems. Could that be related to her diabetes?
Yeah, as a matter of fact, I actually forgot to mention to you yesterday long-term complications. So those can include heart problems such as hypertension, kidney problems, nerve damage, and blindness. So there you go, long-term complications of diabetes.
Thank you.